Thank you so much, Andrew. I am Ginger Heidel with the Coastal Health District, and tonight I am joined at the desk by Angela Hartley, who is a nurse practitioner and also the Director of Clinical Services for the Coastal Health District. Thank you so much for being here tonight.
Thank you.
It is October, which is Breast Cancer Awareness Month, and tonight I want to start by talking about those regular routine screenings. Why should someone go ahead and start getting those regular screenings even if they don't seem to be having an issue?
It's important to go ahead and start screening mammograms even if you don't have an issue. The mammogram is able to pick up small breast cancers that you can't feel yet, you can't palpate yet, and the treatment may be less and usually have a better prognosis.
So early is really key when it comes to detecting breast cancer.
Early is much, much better.
So with that in mind, when should the average woman start getting regular mammograms?
Women should start screening mammograms at age 40.
At age 40. And if you've got a history of breast cancer or special conditions, that's a moment to talk to your doctor about that,
Right. If you have a strong family history of breast cancer or other type of cancers, then you can talk to your provider. There's some screening tools that can be used to see if you need to start screenings earlier or if you need to follow like a high-risk protocol.
Okay, so if someone's watching this and they don't have health insurance coverage, they may think, well, this sounds great, but I can't afford to go get a mammogram because those are going to be expensive. But the district does have a program to help with that. Can you tell me a little about it?
Right, we have a program, it's called the Breast and Cervical Cancer Prevention Program, and it funds women's mammograms as long as they're uninsured and they meet income requirements. It also, that same program also will cover their physical exam when they come into the health department with a clinical breast exam and a pap smear if they need it as well.
So this program covers breast cancer screening but also cervical cancer screening. So let's talk about that for a moment. When should women begin getting screened for cervical cancer? Women
should start getting pap smears when they are 21.
When they're 21, okay. So if somebody is feeling a little anxiety about having this done, I've heard people say before, even people in my own family, like, I'd just rather not know. I just don't want to find out. What would you say to somebody who's having those feelings?
It's very common for women to have those feelings. But if we can go ahead and know the result, even if the result is not a good result, even if it does show that you have cancer, we can tackle that cancer. We can go ahead and treat it early and hopefully have a much, much better outcome.
So if it's going to happen, it's better to know early so that you can really get on top of it, because the treatments are getting better all the time to help women through this. And men can also get breast cancer too. So anytime you've got an issue like that, better to catch it early.
Right.
Okay, so if there's anyone who would like to find out more about how they can get involved with our program and these free screenings, what do they need to do?
They just need to call their local health department. The staff at the health department can let them know if they qualify. There is an income requirement, and then it's for uninsured women or women who have very limited insurance that doesn't cover these services would still qualify. So if they just call their local health department, then the staff can let them know if they qualify and they can schedule them an appointment at whichever health department is most convenient for them.
Okay, that's great information. Thank you so much, Angela.
Thank you.
I appreciate that.